New data has revealed the percentage of South Australians clogging up emergency departments unnecessarily with lower back pain, prompting new resources to help them manage, treat and prevent it at home. To talk us through the study and the new website, we're joined now by Professor Anne Burke and physiotherapist Joseph Orlando from the Central Adelaide Local Health Network. Thank you both for joining us. Firstly to you, Joseph, what does the data show about those who are presenting unnecessarily to emergency departments with back pain?
Well, there are lots of people presenting to hospital emergency departments for back pain. There are probably 12,000 presentations that we analysed over a 5-year period of people that came to a public hospital emergency department, and that included both metropolitan and regional hospitals. And we found that there were a lot of people that presented in an ambulance to a hospital. In fact, it was 1 in 3. And that's quite high, much higher than the national average for ambulance arrivals. We also found that people were more likely to be triaged as less urgent, over 50%. And what that means is probably they didn't have a life-threatening condition. And so these people often waited long periods in the emergency department. Very few needed an X-ray, it was less than 10%. And most were able to be discharged back to their local healthcare providers for continuation of care. And very few required hospital admission. So it tells us that there are a lot of people that often wait long periods in hospital and get very minimal intervention, often maybe just a prescription to be sent back to their local healthcare providers.
Yeah, okay, so and this has led to new resources to help people manage this outside of hospital. Can you talk us through that?
Sure. So the Low Back Pain Project is a really exciting collaboration across a really large part of the state, led by the South Australian Chronic Pain Statewide Clinical Network in partnership with the Commission on Excellence and Innovation in Health, University of South Australia, SA Ambulance Service, and our partners in the local health networks in Central Adelaide or Carlin and Southern Adelaide or Salem. And this is just one piece of that project. So we know that you can Google low back pain, you can pull up all sorts of information, but it's really hard to know which information you can trust or what recommendations you should follow. So we wanted to make it much easier for the community. And so we worked with our consumer experts and our clinician experts to pull together and curate the information. And then we reimagined the South Australian Health Low Back Pain website to be able to bring this information together. So it covers what we now know about pain science and what that tells us about what's happening in our body and how to understand pain. It covers a range of information about different treatment strategies or management strategies that people can try at home. Importantly, it gives really clear advice on when to seek help. So what are the markers that you should look for on when to seek help? And it talks about medications in pain management and when imaging may or may not be required. So we hope it comes together as a really useful resource to empower people to understand what's happening in their bodies and to have some sense of things that they can try at home and know when to link with their healthcare providers.
Fantastic. Professor Anne Burke and physiotherapist Joseph Orlando, both from the Central Adelaide Local Health Network, thanks so much for your time.
Thanks for having us.